When we think of emergency care, what comes to mind? Speed, right? A screaming siren, an ambulance flying down the street. But what if all that speed is just an illusion? What if the most critical moments of an emergency actually happen in the quiet gaps between the sirens? Well, this is the story of how emergency care is being totally redesigned, from a frantic reaction into something way more powerful: infrastructure. Okay, so to really get this, let's start with a story. It's a story that just perfectly captures the problem. This is about a paramedic named Lydia and a 4-minute wait that felt like a lifetime. So picture this. Lydia is behind the wheel of her ambulance. Siren is blaring, lights are flashing. In the back, she has a woman who's in active labor, and it's complicated. There's heavy bleeding, the contractions are coming faster and faster. Every single second matters here.
So she does exactly what she's trained to do. She calls the nearest hospital to give them a heads up, but nobody in the emergency unit picks up. She tries the main line, gets transferred, then gets transferred again. When she finally gets a hold of someone in the maternity ward, they're not even sure if a delivery bed is free. They have no idea about the operating theater. The blood bank hasn't even been alerted.
By the time Lydia gets the go-ahead and that gate finally swings open, the ambulance has been just sitting there, idling, for 4 minutes. 4 absolutely critical minutes lost. Not on the highway, but right there at the front door. The vehicle was fast. The system was not. And that story, it just lays bare this fundamental truth. I mean, what good is a fast ambulance if the team on the other end has no idea you're coming? It's the difference between just putting on a show of being fast and actually having a system that's built for survival.
And here's the thing. Lydia's story isn't some isolated, one-off incident. No, it's a symptom of an entire global system of emergency care that was basically built from the ground up on reaction, not preparation. And this problem is just universal. It doesn't matter if you're in a rural community dealing with spotty cell service and paper notes, or a huge city with the fanciest ambulances. The result is the same. The coordination just falls apart. Nobody knows for sure about bed capacity. Surgical teams aren't activated ahead of time. Prep work that could have been done an hour ago only starts when the patient is wheeled through the door. It's the same broken system no matter where you are.
And this, right here, this is the heart of it. We've spent so much time and money improving the wheels, making the ambulances faster, the equipment shinier. But that invisible layer, the system that connects the paramedic to the surgeon, the clinic to the hospital, that whole coordination layer has been completely left in the dust.
So it kind of forces you to ask this really big question. What if we just stopped thinking about emergency care as a place you go to, the ER department, and started treating it like public infrastructure, like a power grid or a water system, something that connects everything seamlessly? So if we need this new infrastructure, how do we actually build it? How do we create that missing coordination layer? Well, let's take a look at what the solution looks like. Okay. So this is where a company called AfriPharm Health enters the picture. And what they're doing is so smart. They're not trying to build more ambulances, they're building the system itself. They call it an emergency partner network. So what exactly is an EPN? Let's be really clear, it is not more hardware. It's a software platform. It's a live, shared network that basically acts as the digital nervous system for the whole emergency response. It's the connective tissue that's been missing all this time.
And check out who it connects. We're not just talking about the ambulance and the hospital. The EPN links the dispatchers, the ambulance crews, the hospitals, all the way to specialist doctors, and even trained healthcare workers out in the community. It creates one single, unified system where everyone knows what's going on.
All right, that all sounds great in theory, but what does this actually look like on the ground? How does it change things? Let's walk through a couple of real-world scenarios. Okay, so let's replay Lydia's story. Without the network, we know it's chaos. But with the EPN, the second that local clinic hits the alert, the receiving hospital gets structured digital data, vitals, risk factors, the whole picture. So the obstetrics team is activated before the ambulance even gets there. The operating theater is already being prepped. The whole system is ready and waiting for the patient. And it works exactly the same for, say, a major car crash in a busy city. Instead of the ambulance just showing up with a patient, the EPN sends a detailed trauma alert ahead of time. So now the hospital can reserve the CT scanner, the blood bank can get to work, the surgical team can start assembling. The hospital's response literally begins the moment the ambulances does.
And this phrase just nails it.
With a network like this in place, arrival isn't a scramble anymore. It's not a negotiation for resources. It's a seamless transition of care. Time isn't wasted on phone calls and logistics. It's spent saving a life.
So what we're really talking about here is this massive shift in how we even think about emergency medicine. It's about moving away from relying on the heroic efforts of one person and towards something so much more reliable.
This table just sums it all up perfectly. We're moving from reactively assembling a team after a patient shows up to pre-activating them before they even arrive. We go from a verbal, yeah, I think we have a bed, to seeing real-time capacity. And maybe the most important shift of all, we stop measuring motion metrics, how fast the ambulance drove, and we start measuring intervention timestamps. How quickly did the actual life-saving care begin?
So if you take just one thing away from all this, let it be this fundamental change in perspective. Emergency care, it is not just a room in a hospital.
It's a network of people, of resources, all connected, all coordinated, all working together as one.
And the most powerful thing about a well-designed network is that it doesn't leave survival up to chance or up to the heroism of one person like Lydia having a good day. It builds survival right into the system itself through intelligent design. And that's a future worth building.